The causes and treatments of vaginal discharge during pregnancy. During pregnancy, physical changes can cause surprises and worry. That's why it's best to know what to expect. From the first moments of conception, a woman's body begins to change. One of the first changes a woman notices is an increase in vaginal discharge. Although this phenomenon is normal and usually does not indicate any serious health problem, the causes are varied, and, depending on the cause, these secretions may indicate a complication. Leucorrhea, the medical term for these vaginal secretions, is thick, milky cervical mucus that fluctuates between white and transparent in color. This mucus begins to appear 2 weeks after fertilization. It is the placental hormones that produce this secretion in order to protect the uterus. Over the weeks, the secretions increase and become more noticeable a few weeks before childbirth. The reason is as follows: the baby starts to exert pressure with his head and then pushes the vaginal secretions towards the exit. When vaginal secretions have features other than those listed, they may indicate a health problem. In these cases, it is necessary to consult a gynecologist. Vaginal infections, one of the possible causes of vaginal discharge during pregnancy. Vaginal infections are common during pregnancy, especially from the second trimester. In case of vaginal infection, vaginal secretions are greenish or yellowish and have a strong odor. Irritation and a burning sensation are other symptoms that can accompany these secretions, as well as pain when urinating or having sex. The vaginal candidiasis or infection is caused by an imbalance of the pH levels of the mucosa. This imbalance promotes the development of the fungus Candida. High sugar levels in normal vaginal secretions also create a conducive environment for this fungus. Although this infection does not represent any danger, it is desirable to go to the doctor as soon as possible in order to undergo treatment quickly. Otherwise, the infection can be passed on to the baby during childbirth. The most common treatment during pregnancy is creams and suppositories, as it is not known whether oral medications are completely safe for the fetus. To prevent vaginal infections, the American Pregnancy Association recommends the following tips. Wearing loose cotton underwear. Use neutral and fragrance-free soaps. Dry the genital area with a hairdryer on low heat. Clean your vagina from front to back after you defecate. Do not stay in a soaking bathing suit. Take a shower, dry well, and change clothes after exercising. Not douching. Consume yogurt with probiotics and reduce your sugar intake. Bacterial vaginosis. We speak of bacterial vaginosis when the bacterial population of the vagina is greater than normal. The root cause of bacterial vaginosis is unknown, but it is believed to be related to sexual intercourse. About 10% of women suffer from it. A woman with bacterial vaginosis does not always have symptoms, but she may see grayish discharge that smells like fish. Usually, during pregnancy, a woman needs to have tests to determine whether or not there is bacterial vaginosis. This infection can cause premature labor and even spontaneous abortions. Usually, treatment is with oral antibiotics or as a cream. Sexually transmitted diseases. The presence of a sexually transmitted disease (STD), such as gonorrhea, chlamydia, syphilis, or trichomoniasis also causes the peculiar vaginal discharge. In this case, the secretions are usually yellowish or greenish and have a strong odor. These diseases can cause premature deliveries and abortions. They can also be transmitted to the child during childbirth, which can have serious consequences for the health of the baby. Placenta previa. When the placenta is poorly positioned and blocks the cervix during the last weeks of pregnancy, it is called placenta previa. This condition can cause abnormal bleeding during pregnancy and around the time of childbirth. Usually, placenta previa is detected via routine ultrasounds from the 20th week of pregnancy. The women concerned generally have to continue their pregnancy in bed and are subject to more checks. In the most extreme cases, the woman may be required to remain at rest in the hospital or to give birth earlier by caesarean section. Vaginal secretions during pregnancy, how to manage them? It is not much you can do to prevent normal leucorrhea. Nevertheless, it is advisable to take more care of your genital hygiene in order to avoid complications. Keep the genital area clean and dry. Always dry the area from front to back. Using cotton compresses. In the event of a change, increase, color, odor, etc., it is important to promptly notify your doctor.